Good evening, sir. Vellore IMA is very happy in hosting this meeting. I sincerely thank YSS India for this joint webinar, Quest for Excellent Guided Meditation. My sincere thanks to the speaker, Swami Shraddhananda Giri, the senior monk of YSS Ashram Branch. We, as being doctors, we are too much stressed in whatever things we do, whether it's the professional life or in the personal life or in the family life. So we need a doctor to succeed. They should have a focus. To have a focus, we should train ourselves to be focused on whatever things is required, and to have that focus, meditation helps us. So that is why we wanted to arrange this guided meditation program for our members to all the other people. Thank you, sir. I sincerely thank Dr. Kumaran, Dr. Prabhakaran, who have been the men behind this show. Thank you, sir. I welcome everyone.
Dr. Prabhakaran?
Yeah. Thank you, Dr. Madan, for this nice welcome address. I wish everyone present here a very happy evening. I feel extremely blessed and honored in giving a brief introduction about Swami Shraddhananda Giri. Swami Shraddhananda Giri is a senior monk of Yogoda Satsanga Society of India, or YSS, founded by Paramahansa Yogananda in the year 1917. Swamiji first became interested in spiritual and metaphysical subjects at the early age of 13 and decided to dedicate his life to the search for the ultimate verity when he was 16 years old. In the year 1976, he joined Yogoda Satsanga Society of India as a monk and has since served in the Ranchi ashram for the last 44 years. Swamiji has been assigned various responsibilities, including making available Paramahansa Yogananda's publications to the Indian masses, as well as the responsibility for the spiritual guidance of YSS sannyasis. Swamiji has traveled all over India and abroad in order to disseminate the how to live and Kriya Yoga teachings of Paramahansa Yogananda. Now, I invite Swami Shraddhananda Giri to deliver his speech to the audience. And if the audience have any doubts, they can type in the chat box. At the end of the speech, one of us, on behalf of you, will ask these questions to Swamiji. Now we will listen to Swamiji's speech. Over to you, Swamiji. Thank you.
I'm very grateful to all of you for having invited me and for your kind welcome and greeting. In preparing the matter to be presented today, I wanted to make it relevant for the medical profession. So I thought I would have a look at the oath which people who are entering the medical profession take. It's called the Hippocratic Oath. And I saw a version of that which was created for an Indian audience. There was one portion of it which I liked very much, and that was, I will treat my patients as I would like a doctor to treat me when I am not well. And I think that sums up the quality of excellence, which is required for all medical people. They have to treat the people whom they are taking care of in a way in which they would like to be treated if they had had the same illness which their patients have. So this is a very high ideal. And I think as human beings, we may not be able to live 100% by these ideals, but every effort we make to follow that principle, follow those ideals, is taking us closer to excellence, is taking us closer to the goal, not only of our medical careers, but also the goal of our lives. In addition, I found 3 other things that were mentioned in the Hippocratic oath. And those 3 things are: one is care of patients. We are to take care of the patients with all our heart, with all our knowledge, with all our sincerity, with all truthfulness. And there are situations where we don't know exactly what to do. For example, if someone has some serious illness, we may feel, or even the family of the people may tell us that don't tell the patient what's wrong. Or the patient may say, don't tell my family members what's wrong. So there are important decisions that the doctor has to take. And it is difficult to take those decisions unless we have this ideal of wanting to treat the patient in the way that I would like to be treated by my doctor if I had the same illness. The care of the patient needs a great deal of tenderness, a great deal of empathy, a great deal of honesty or truthfulness. And truthfulness is not just stating facts. By telling a blind man that you are blind, we are not being truthful. It may be a fact, but truthfulness involves upliftment of the person who we are speaking with. So truthfulness needs a great deal of discipline. I remember, maybe some of you have read Autobiography of a Yogi, which is the autobiography of Paramahansa Yogananda Giri, who's on the side. In the Autobiography of a Yogi, Paramahansa Ji has described his life mission, his life work. And one of the things that Paramahansa Ji's main mission is propagating or letting people know about how we can meditate. And through meditation, we can experience the true nature of ourselves, which is a part of the true nature of God. So in propagating that scientific technique of meditation, we experience our true self. And when we experience our true self, we also begin to understand, we begin to know through experience the true self of the others who are with us. When we recognize that my true self and the true self of others, which includes my patients, is the same, then there is a spontaneous desire, a spontaneous determination to treat that person the way we would like to be treated. It requires a great deal of discrimination. It requires a great deal of discrimination to say the right thing and do the right thing. There are many thoughts that may come into our minds. And before we give outer form to those thoughts in terms of our words, Swami Shraddhananda Giri, the guru of Paramahansa Yogananda Giri, Guruji would say about Swami Shraddhananda Giri that he weighed his thoughts carefully in the delicate balance of discrimination before he permitted those thoughts the outward guard of speech. I think you all realize how much discipline this involves, because there are so many thoughts that come into our mind, and often the thought is just coming out of our mouth without weighing the value or the benefit that thought may have for the person that we are speaking with. So a lot of discipline, a lot of discrimination is needed by each of us, and especially by those in the medical profession. I would like to say especially, I'd like to add a second category. The second category is the people that we live with and the people that we work with. Because when we are living with someone many hours every day, when we are working with someone many hours every day, the tendency will be to be more relaxed, and that means to be less discriminative, to use less discrimination in filtering our thoughts and before we let them out as words. I know I saw one of your YouTube events. I think it was a couple of weeks ago, and there were two people who spoke. It was, I think, more than 2 hours long. And one of them talked about everything that I'm going to talk about today. So those who had participated in the last YouTube video of the Indian Medical Association, Vellore, may not find much new material in this talk. I was very impressed by the devotee. I think her name was Dr. Manjula, that's right. And I was very impressed by her, and also by the second person who was the main speaker, one of the two main speakers, who talked about his his experiences while he had COVID. Initially, he had no symptoms, though he knew he had COVID. Then the symptoms gradually came. The symptoms were very mild. They became more serious. Then he realized that he had difficulty breathing. He realized that his blood oxygen level was going down. Then he realized that with oxygen, it was coming back up. Then he realized that even with stronger and stronger doses of oxygen, his blood oxygen levels were not coming up. Then he realized that he found it extremely difficult to breathe. And then he had to, I think, be on the ventilator or something like that. And finally, he became well. So there is a great deal of people who know what can happen. There is a great deal of fear, a great deal of apprehension that the doctors may experience, even though those who have COVID may not realize how serious they could become. So when we have awareness of what can happen, we have to be very careful about the way we express to the patient what is likely to happen or what could happen or what is happening. Similarly, when one is at home and with people that he has known for a long time, we tend to have less discrimination in deciding what to say. And when the discrimination is not there, then we may say something that may hurt someone. I remember once I was talking with my mother, and there was another relative of mine. Later, he told me that if I had spoken to your mother the way you spoke, if I had said the same words to your mother that you spoke, she would have got terribly upset with me. And she didn't get upset because she knew I loved her. So I could be a little more clear, and she realized that I had no ill will. I had great love, I had great empathy for her, and therefore, whatever I said, she accepted. She opened her heart and accepted what I said. So we have to develop that relationship with our family members, and it is more difficult to develop that relationship with our patients because we don't know them for long enough. They don't know how good we are. When I say good, there are two aspects of good. One aspect is how morally good we are, how in our nature, how good we are. The second aspect is how good we are at our profession. Suppose somebody is very good, then the patient can trust, and that patient knows that he is a good person. Then he can trust that person. Suppose we are good in our knowledge of the medical field, then the patient can trust us to be his doctor. If he knows that I'm a very good man, but I don't know anything about medicine, and I don't know anything about brain surgery, and I'm going to operate on his brain, no matter how good I am, he's not going to feel comfortable. So we have to be good as a person, and we have to be good in our understanding of our field. So when we are both kind and wise, then we can be trusted. So doctors need to be kind they need to be empathetic, and they need to be knowledgeable. They need to know their subject well. And so I'm going back to the Hippocratic Oath. The first subject, the first topic of 3 topics is care for the patients. And care for the patients we can do when we are empathetic towards them, when we care for them, when we are good-natured, and we also have the knowledge that enables us to serve the patients. The second quality that is mentioned in the Hippocratic Oath, according to this version prepared by someone for Indian doctors, is research. Part of being good is to keep researching your subject. And if someone is out of touch for 6 months or 1 year, he is no longer a doctor, because he doesn't know the progress that his field of medicine has made in the last 6 months or a year. So we have to keep constantly updating ourselves in any chosen subject. And the quest for excellence is the quest for improving our nature, as well as improving our knowledge in whatever field that we are in. The third quality mentioned in this Hippocratic Oath is teaching. All of us in the course of our many years in our field, we have an understanding that we develop. For example, 40 years ago, if someone came to me with some question, or 30 years ago, or 20 years ago, or even 10 years ago, if someone came to me with some spiritual question, my answer would be different from what my answer is today. And that is because with our experience, we recognize that the answer I would give 10 or 20 or 30 or 40 years ago is not the most appropriate answer for this person, for this question today. It depends not only on the person, it depends not only on the question, it also depends on the person. So before we answer some question that someone may have about spirituality, about the spiritual path, we also have to know the person, because different people may ask the same question. And because people are different, they need a different answer. So we have to share our research. We have to share what we have learned with others of the medical profession, and in my case, share with other monks. So that the answer I would have given 40 years ago is not necessarily the answer they would give today, though they may have been monks for a shorter period of time. So we have to care. We have to improve our knowledge, and we also have to teach. So this is the Hippocratic Oath, and the most beautiful part of it is, if I am the patient, how would I like my doctor to treat me? And I should treat my patient the way I would like to be treated by my doctor. That is, I think, one of the most important aspects of excellence. And there are many other spheres. One of the important discoveries that I had long ago is that I was interacting with someone who had a big store and also various other services. There were three brothers who were running the store, and one of them had a very big tika. Another had, he used to freely talk about pujas and God and things like that. And there was a third brother who told me that, I am not spiritual, I'm not religious. And he didn't have that big tika, and he didn't talk about God and spirituality and religion and things like that. But I noticed that out of all those three brothers, this particular brother, he was more honest. He was not wanting to sell the costliest equipment to me. He was wanting to find out what my needs are so he can sell to me the equipment which is most beneficial to me. So this person had discrimination. This person was honest. This person didn't have the outer signs of religiosity or even spirituality. But I felt that he was the best of those three brothers. I had been in touch with him for many years after that, and I am amazed to see how much he has progressed, not only in his goodness, that means how much of a humane and an admirable person he has become, but also at the degree of success that he has achieved in his fields. He has been pursuing excellence, and by pursuing excellence, he is becoming more and more excellent. I tried to look up the dictionary meaning of excellence, and there are some words which are so inspiring. Some of the words are sublime, meanings of excellence. Sublime, glorious, awesome, magnificent, wonderful, incandescent, lustrous. So those who are pursuing excellence, they become more and more of a light which other people are spontaneously seeking. All of us like people who are bright, and bright means happy, bright means cheerful, bright means intelligent, bright means knowing the right thing to say, the right way of saying the right thing. So automatically everyone is guided, is drawn towards someone who is lustrous and incandescent, and some of those other words, sublime, glorious, awesome. Awesome is a word that many people are using nowadays, and I like that word. When we are pursuing excellence, we are trying to become awesome. And I know all of us like to become awesome. I know all of us like to be in touch with someone who is awesome. Two other meanings of the word excellence are matchless, supreme. I think within each one of us, even those of us who are very humble, we want to become matchless, we want to become supreme, not for the sake of ego, but for the sake of development. we want to develop in our field of study, in our field of activity. And as we want to keep growing in understanding, we become little by little matchless and supreme. I remember one story that Paramahansa Yogananda Giri, who founded this organization and whose picture is here, who is the author of the Autobiography, and who founded this organization more than 100 years ago, he tells the story. This story is not in the Autobiography, but this is the story. Once Paramahansa Ji he wanted to go from one place to another place, and there was a big crowd of people in front of him. He told himself, I want to be at the head of this crowd. So what he did was, whenever there was a small gap anywhere, he went into that gap. Then he found a second gap somewhere, and he went into the second gap. Then he found a third gap, and he went into the third gap. And after a while, he was at the head of the crowd. So we can become matchless, we can become supreme, we can be ahead of everyone else without pushing anyone aside, without treading on anyone's feet, without harming anyone else. Whenever we have an opportunity, if we are looking for opportunities, if we are using every opportunity we get to move ahead, not with the idea that, I will be ahead of this person, but with the idea that there is something within me who wants excellence, who wants to be best in whatever I do, or who wants to be one of the best in everything that I do. So that quest for excellence is a natural manifestation of the true nature of my own being. The soul, the particle of God, which is within us, the Atma, which is a particle of the Paramatma or the Supreme Spirit, is excellent, it's supreme. And we all, because we are a part of that, our true essence, our true nature is a particle of God. And because we are that, we spontaneously want to develop. We want to grow in understanding. We want to grow in knowledge. We want to grow in the expansion of our consciousness. We want to grow in our love for people so that we care not only for a small family of 2 or 3 or 4 or more, father, mother, brother, sister, son, daughter, and other close family members, but also the other people with whom we interact. Our love expands. We no longer have a small circle of love. That circle of our love, that circle of those people who we consider to be a part of ourselves, to be most close to ourselves, when we are pursuing that quest for excellence, that circle becomes bigger and bigger. And more people are treated by us in the same way that we would like to be treated by those people. So the circle of our love keeps expanding. And that is because we are knowing who we are. We are experiencing who we are. And therefore, we are knowing who those other people are. We are experiencing what those other people are. We see that there is that same essence in me, which is there in other people. So we can feel an affinity, we can feel a closeness, we can feel a sameness between me and others. And when that sense of sameness is there, when that sense of that person is not different from me, then there is a natural empathy, there is a natural goodness that we begin to express. Our circle of love becomes bigger. One of the qualities that are necessary for us to learn to grow, learn to improve ourselves, learn to have greater understanding of our subject and understanding of people is introspection. Those who practice introspection, they say that, there's a lot of scope for me to improve. Those who don't practice introspection, they say, I am very good. I haven't killed anybody. I just killed 20, 30 different tiny ants and insects and lizards and rats and little creatures and so on. So I'm very good. The persons who introspect and want to be better when they introspect, they say that, there is a lot of scope for improvement. There's so much I can do, which is more. I can do so much more. I can do so much better. I can be a much better person. I can act differently. I can speak differently. I can think differently. I can have a different attitude than the attitude I have. I can have a different motive from the motive that I express most often. And that introspection helps us to become humble. And humility is a word that not many people like very much, because it feels like, you're a small person, and nobody likes to admit that he's a small person, even if he knows that he is a small person. Humility means that I know I am not perfect. And I think each and every single one of us knows that I am not perfect. There is scope for improvement. I can improve. I should improve. I want to improve. And that is humility. And self-improvement needs humility. Humility is created by the desire to improve yourself. And the desire to improve yourself creates an awareness of you not being the greatest person on the planet. Sometimes I exaggerate a little bit, so it's easier to see that what I'm saying makes sense. Not everybody says that I'm the greatest person on the planet, but many teenagers say that, I know more than my father and mother. And they may say that I know more than anyone else who wants to advise me. But if we say that a teenager thinks I know much better than anyone else on the planet, the teenager will say, that's not 100% true. Though I know more than my parents, there may be someone on the planet who knows a little bit more than I do. So that arrogance, which is the absence of humility, which is the absence of knowing that there is scope for improvement, is created by introspection. And therefore, introspection is a very important aspect of our search for excellence and our quest for excellence and the gradual approaching of excellence that is achieved when we are consciously seeking excellence. Another quality we need to develop is perseverance. We like to achieve certain goals, And I think we will find that even after 10 or 20 or 30 or 40 or more years, we have not achieved that goal. That doesn't mean we haven't improved. What it means is we haven't reached that goal 100%. For example, if someone has a temper and he wants to overcome that nature, after 10 or 20 or 30 or 40 years, he may find that I still have a temper. If someone, for example, tends to have self-pity, that means tends to go into a low state, a state of depression, not medical depression, but a state of not feeling so good. Okay, so if, for example, one has the tendency for blaming oneself, having self-pity, and we see, for example, one of my relatives was that way, and as a child, I remember praying for that particular relative, because I saw that she was unhappy a lot of the time. She was sad a lot of the time. One devotee told me, it's a very strange remark, but the remark was, she loves to suffer. I think none of us love to suffer, but so many of us are in the habit of feeling sad that we feel sad more easily than others feel sad. So this relative of mine, I used to pray for that relative, that sadness reduce. And once many years later, I had been praying for a long time, many years. And about 40 years later, from the time I started praying, one day that relative called me and said, so-and-so happened, and she was very, very sad. And what she told me is she's going to take a full strip of some medicine. I don't know what that medicine was. And I think the purpose was that she go to sleep, not for a short time, but for the rest of this body's life. I was so shocked. I was so shaken. The whole day, I felt miserable. And then in the night, I called her back, and she was very happy, very cheerful. I was wondering what happened. In the morning, she was very different. And in the evening, she was bright and cheerful. So I told her as mildly as I could, because I didn't want to bring her back into the state in which she was in the morning. I said, in the morning, you were a little bit sad about something. She said, all that was troubling me, I just vomited out everything onto you, and now there's nothing troubling me, so I'm happy since the time I called you in the morning. Why I'm telling you this story is that when I heard what she said that day in the morning, I felt my 40 years of praying for her was useless. We think that when we pray for somebody, some miracle happens and everything becomes all right. But I saw that I was praying for her for 40 years and she's just the same. She hasn't changed. That's not true. Previously, when she used to become sad, she used to become sad for a long time. She used to also become unconscious. That degree of, darkness that she used to go through would make her unconscious. And she would stay in that sad state for many hours. Later, she used to also become sad. And 40 years later, she used to become sad once in 6 months. So had my 40 years of prayers worked? Yes, they had worked. She was still sad, but not so frequently. She was not sad for long periods. That means when she would become sad, she wouldn't become sad for so long. She would become sad less frequently. So the frequency would come down, the duration would come down, and the intensity would come down. Now, this 40 years later, intensity was very great, but in general, the intensity would come down. So there are changes that do happen. We have to be patient. We shouldn't expect that I will pray today and the prayer will work within a short time. Prayers always work. They may not work in 40 years, or they may not appear to work in 40 years, but they are working from the first second that we pray. A transformation is happening from the first second that we pray, but we may not see that transformation during the first second. We may not see it during the 10th year. We may not see it during the 40th year, but that doesn't mean that the transformation is not happening. So we should be patient. Patience is one of the qualities that we need in order to move towards excellence. If we are truly seeking excellence, we have to learn to be patient with ourselves. We have to learn to be patient with others, because that will help us to become a better person, and that will help us to make everyone whom we are in touch with, our immediate family, our immediate work group, and those that we are entrusted to care for. That means the patients. It will help them if we work towards excellence and also work towards patience. Before I go to the guided meditation, I would like to tell you something. Excellence is a pursuit of the nature of the soul. We have a soul, we have an Atman, which is a part of the Paramatman. And because our truest nature is the Atman, we cannot escape from the quest of excellence. The most perfect knowledge, the most perfect peace, the most perfect joy, the most perfect love, the most perfect understanding, knowledge, or wisdom, the greatest expansion of our own consciousness is our own nature. And therefore, everything we do that can be of benefit to any single person is a natural expression of our true self. So when we see that I am this way, which is not good, I am that way, which is not good, we have to remember that that is not me. My true nature is light and joy and love and peace and maturity and understanding and an expanded consciousness and the perfection that all of us are seeking. So now we will have a guided meditation. First of all, the purpose of meditation is to achieve a state of inner calmness, inner strength, a state in which we are unshaken amidst the crash of breaking worlds. I know that many of us are shaken by the pandemic that we have experienced. Hopefully it is reducing. Some people say it is increasing. One doctor told me yesterday that for the first time in 6 months, she's given permission to take leave. And that is because in her place, the pandemic is reducing. So another person told me, another person I heard saying that this is not a pandemic, this is a prem-demic. That means during this pandemic, we are recognizing the value of each other. And we are having prem or love for each other, which we did not have to the same extent or towards the same number of people that we had before the pandemic. So the prem that we have now is expanded compared to the prem we had before the pandemic, which is now can be called a prem-demic. And prem is something that is the purpose of our meditation. The purpose of our meditation is to have more prem, to have more peace, to have more joy, to have a greater sense of security, to have a greater sense of well-being. So when we remember that that is the purpose of our meditation, many people think in terms of, when you're meditating, you're seeing this, you're hearing that, and there are some beautiful sensations going on in the spine and in the brain and all beautiful things. That is something that may happen. That is something that is not necessary. What will definitely happen is an experience of peace. What will definitely happen is an experience of inner joy, a sense of inner stability, a sense of inner contentment, and a sense of abundance, a sense of understanding for other people. Why is this person behaving in the way that he is behaving? He is behaving in the way in which he is behaving because that is how I would behave if I was in his condition. In his condition means not only in his condition, but also in my understanding. If I had the understanding he had, and I were in the condition, external circumstances that he is in, I would behave exactly in the same way. That is understanding. And when we have an understanding of why people are crying, why people are unhappy, then we have spiritual understanding. We have spiritual wisdom. then we can empathize with people, we can help people, we can uplift people. So the purpose of meditation is to take us into that inner state where even if we are not having any light and sound shows, we are becoming more peaceful beings. We are becoming more saintly beings. And when I say saintly beings, I mean beings who have a large family. Anyone who goes to a saint, he does not discriminate against that person. He may be yelling with the anger, but the saint doesn't have any dislike for that person who's behaving in a way that other people might find it difficult to love that person, to accept that person. That is saintly behavior. And the meditation that we do is helping us to become more saintly in our behavior. Okay, so let's do a little bit of a guided meditation. I think the devotee, Dr. Kumaran, no? Who was it last time? Who conducted that YouTube session? Manjula. So I will repeat a portion of what Manjula has already taught you in your previous YouTube session. I don't know how much time we have, and I don't want to exceed the time. I don't know how many questions there are. So in any case, I'll do a little bit. Okay, so one of the things that we can do in this guided meditation, we can all do together in this guided meditation, is do a tension relaxation technique. Now, physical relaxation is difficult when you are mentally tense. Do you know that? When you're worried about something, there is some tension. It may be in the shoulders, it may be in the jaws, it may be in the chest, it may be in the knees, it may be somewhere. And for different people, it may be in different portions of their body. When we learn to physically relax ourselves, when we learn to relax the physical body, we are more likely to relax the mind. That means the mind will be less restless, it'll be less agitated, it'll be less jumping from one thing to another. We will have greater concentration. We will have greater mental stability. We will have greater emotional stability. And this is another thing that was mentioned during the last YouTube session that you had, that when doctors come across patients who are suffering so much, they become sad. And when they're working long hours, they have burnouts. This doctor who told me a few days ago that for the first time in 6 months, she's been permitted to go on leave. She was working 16, 18 hours every day. Some of them were working inside the ICU of the COVID patients. 16, 18 hours every day. Will burnout not happen? Will mental sadness not happen? It's likely to happen in almost every case. I said almost every case. And if we sincerely meditate, hopefully it will not happen so much in our case. So we gain not only a mental relaxation, we gain an emotional relaxation also. That burnout which takes place when anyone is looking after anyone with a serious life-threatening illness is less likely when we meditate because of the results, because of the side effects of meditation. The goal of meditation is union with the Paramatma. The side effect of meditation, just as you have side effects of your medicines, the side effect of meditation is stability and mental and emotional strength. Its side effect is peace. The side effect is joy. The side effect is wisdom. The side effect is love. The side effect is everything that we want, everything that we long for. All those things are the side effect of meditation. The goal of meditation is oneness with God. So let us remember that when we meditate. Otherwise, we'll be seeking light and sound shows. And then he said, I meditated, but nothing happened to me. I didn't see lights, I didn't hear sounds, I didn't feel experiences. No currents, no this, no that has happened. And that's fine. If it does happen, it's fine. If it doesn't happen, it's fine. The goal of meditation is oneness with God. God is peace, God is love, God is joy, God is infinite love, infinite joy, infinite peace, infinite goodness. So let's do the tension relaxation exercise, which, as I said, will relax our body. And little by little, as we learn to practice relaxation more, it will relax our mind, it will relax our emotions, and we will become emotionally stronger. We will become mentally stronger. We have IQ and we have EQ. I think all of the doctors have very high IQ, and all the doctors who meditate will also have very high EQ. And that is one of the side effects of meditation. So let's try to practice this tension relaxation exercise. We breathe in gradually and we tense the whole body. Different people will tense the whole body slightly differently. So you don't have to tense in the exact same way in which I tense. So let's breathe in gradually and we tense the whole body. Then we hold that tension and we hold the breath for a count of 6, which is about 3 seconds. And then we quickly exhale and we quickly relax the whole body. While we are exhaling from the mouth. When we are inhaling, we are gradually inhaling from the nose. Then we are holding for about 3 seconds. And then we are suddenly, quickly relaxing, suddenly, quickly exhaling from the mouth. So let's do that 3 times. Okay, let's inhale. Hold. Inhale. Hold. Inhale. Hold. Exhale. Let's do 3 more times. Inhale, tense. Hold. Exhale. Inhale. Hold. Exhale. Inhale. Hold. Exhale. Perhaps some of you are feeling more physically relaxed and also mentally and emotionally more relaxed now than you were feeling before. As we continue to practice this regularly, we will find that we will gain greater ability to relax the body, and as the side effect of that relaxation of the body, to also relax the mind and also relax the emotions, to become more emotionally relaxed. Okay, what's next? 2020-20? Okay, so this also, all of you know, those who have participated in the previous session, 20-20-20 means that we breathe in gradually for a count of 20. We hold the breath for a count of 20, and then we exhale for a count of 20, and then we immediately after the exhalation, we start inhaling for a count of 20, and we keep doing that 3 to 6 times. Now, a count of 20 is 10 seconds, because when we are saying count of 6, we are saying 3 seconds. When we say count of 20, we are saying 10 seconds. However, for most people who are doing this for the first time, 20 is too long, 10 seconds is too long. So we will do for maybe 5 seconds. I think we can manage 5 seconds. If any of you feel uncomfortable, if you feel 5 seconds of inhalation, 5 seconds of holding, and 5 seconds of exhalation is too long, then you may reduce it to less than 5 seconds. Anyway, so let's do 5 seconds inhalation. This is all gradual. The inhalation is gradual, the holding is of course gradual, and the exhalation is also gradual. And immediately after the gradual exhalation, we do a gradual inhalation. So we don't hold the breath inside, we do hold the breath, no, we don't hold the breath outside, we do hold the breath inside. So let's do that. We can start with 3 times. So let's gradually inhale. I will announce. First we exhale, so we are ready for the inhalation. Then we are ready for the inhalation. We start inhaling. Hold. Exhale. Inhale. Hold. Exhale. Inhale. Hold. Exhale. Let's do 3 more times. Inhale. Hold. Exhale. Inhale. Hold. Exhale. Last time, inhale. Hold. Exhale. Hopefully, many of you are feeling more calm, are feeling more relaxed, are feeling more peaceful within. And as you continue practicing, these are very elementary, preliminary exercises that Paramahansa has taught in his Yogoda Satsang lessons. But as you see, they are very capable of producing a great degree of inner sense of well-being. I think we've exceeded our time. So I think we'll stop here as far as the guided meditation is concerned. There is much more that can be done, but let's see if there are any questions, and I'll try to answer them.
Swamiji, it was an awesome talk.
Thank you.
That's an excellent talk. Thank you so much for sparing this evening for us and giving a beautiful lecture of Quest for Excellence. It was almost like what we face day to day life. So can we take some questions, Swamiji?
Yes, please.
What to do to get treated the way you are treating others? This is Andrika.
When we are treating someone, we should feel that if I was this patient, how would I treat this patient? How would I like a doctor to treat me? So every time you have a patient before you go and meet that patient, ask yourself, suppose I was that patient, what would be my expectations of my doctor? Try to fulfill those expectations. By doing that, we are cultivating good karma. And when we cultivate good karma, we get good fruits of good karma. So if we treat people the way we would like to be treated, we earn good karma. And the fruit of good karma is that other people will treat us the way we would like to be treated.
Thank you, Swamiji. And it's one more question. How to develop perseverance?
Persevere. How do we develop muscles? By exercising the muscle. How do we develop perseverance? By exercising perseverance. It may be 1% perseverance, it may be 20%, it may be 40%, it may be 60%, it may be 80%. But if we keep persevering, we will develop patience. We will develop perseverance. I remember one of the senior monks told me, I was going through a very difficult time, and he told me, try to be patient. He could have said something similar, try to be patient, try to be persevering. And he knew that it was impossible for me in that situation to be patient. So he didn't say be patient. He said try to be patient. So the way to cultivate patience or the way to cultivate perseverance is to try to cultivate patience or to try to cultivate perseverance. Try. I find that I am a little bit more patient now after years of failure in being patient, because during those years of failure, I was trying to be patient. I maybe had 10% success or 80% success, doesn't matter. I was trying. And because I tried for some decades, I see myself as a little bit more patient today than I was those decades ago. When a senior Swamiji told me, try to be patient. He knew patience was absolutely impossible for me in that particular situation. And that situation continued for decades. Okay, so try.
About this 2020, is it the inhalation has to be done through the nose and exhalation has to be done to the mouth? And how many times?
We could do it 6 to 12 times. The inhalation definitely should be from the nose. And I think the exhalation can also be from the nose. When we are doing a quick exhalation, then we are doing short exhalation, long exhalation. So during the 2020, everything can be from the nose.
Okay, sir. What is the difference between sympathy and empathy?
I don't know. Empathy, I think, means that we can put ourselves in that person's place. And I do like to have empathy, but I do warn persons against becoming the way someone else becomes. Let us say there's someone who's very close to me, and that person is extremely sad. He is down in the dumps, you may say. And the example I would like to give is he's at the bottom of a well of misery. He's reached down, he has reached right down to the bottom of the well of misery. Now, if that person is very close to us, what will we do? We will also feel miserable. Correct? That's empathy, isn't it? However, I advise people, don't jump into the well, because then there will be two people in the well instead of one person. And the well is a well of helplessness, misery. So do I want two people miserable instead of one person miserable? I think we would like that one person to come out of the well, not remain in the well, or not add another person to that well. So instead of one unit of suffering, there are two units of suffering. So what I advise is that you stay on the top. That means stay calm. Be aware of what that person is going through. Don't allow that to fully shatter you emotionally. So use the awareness of the peace that you have experienced at the end of meditation. Hold on to that peace. Recognize that this person at the bottom of the well needs help. This person at the bottom of the well is feeling so and so, which I am feeling, which I'm capable of feeling, which I understand that person is feeling. And if I were that person, I would be feeling the same way that that person is feeling, but I want to help. Therefore, I'm not jumping in. I'm staying on the top. I'm holding on to the peace of meditation. I'm reaching out by my words of kindness, my words of inspiration, my words of encouragement, my words of hope, and hopefully pull that person out of the well. So empathy is jumping in the well, perhaps, but I don't recommend jumping in the well. I recommend knowing what that person is feeling, because we have felt the way every other person has felt, including me. I have felt. People think great sadhus and great swamis don't feel miserable. That's not true. I'm not telling you the whole world, but I'm telling you. So stay at the top of the well, extend your hand of help, of inspiration, of encouragement, and bring that other person out.
Thank you, Swamiji. How will meditation help in our doctors in our clinical practice?
First of all, it will prevent burnout, which during emergencies like this, the pandemic, or what I like to call the prem-demic, the love everywhere, it will help you to be more stable. It will help you to be more peaceful. It will help you to think more clearly. It'll help you to learn. That means you've treated this patient. Now this is the 75th patient you're going to. The benefit of all the treatment of the previous 74, you can hold in yourself because you have calmed down. That calming down helps you to hold on to the lessons that you have learned, to the insight you have gained through the treating of those 74 patients. So there are many other benefits. I think many of those I've already mentioned.
During this pandemic of COVID, we know the symptoms of how the COVID patients are coming. So we doctors had a lot of problems in coming out from, because we already know what is going to happen, what are the symptoms. So that has produced a lot of impact in our health, as well as we had a lot of loss of doctors' lives also during this COVID. So this pandemic can definitely, some more pandemic can come, or how to come out from this, because we we know more medicine, so we are treating the patients for our health. So can you just throw some light on this?
Yeah, I think doctors have a disadvantage. I don't like to make you unhappy, but that's the truth. Doctors have a disadvantage. The disadvantage is that they know that the first time they cough, they're thinking of pneumonia and all other things, which the first sign of pneumonia may be the first cough. And the first cough may not be a sign of pneumonia, but they've learned so much that I could have pneumonia, I could have this, I could have asthma, I could have COVID, I could have all kinds of things. So that's the disadvantage you have. The knowledge of where this could take you. Some of us have life-threatening illnesses where the only consequence is death. The death can happen in 1 week, it can happen in 6 months, it can happen in 25 years, but we know that the end of this illness is death. People who don't know what happens at the last stages of that illness are happy. Not happy, but are less sad. Doctors who know that the final stages of this fatal illness are all these conditions, they are much more shaken by what will happen to this person 25 years later or 6 months later. So while we have all that knowledge, we need inner strength, because inner strength is the only thing that can prevent us from destroying our emotional state. And meditation will help us to develop that strength little by little. We also have to tell us that I have to learn to become strong. I have to learn to become more emotionally strong. I have to learn to become more mentally strong. I have to develop greater willpower. And I know that meditation will help me to develop willpower. Meditation will help me to become emotionally strong. There is no easy fix. It's a lot of work.
Thank you, Swamiji. How long do you have to meditate a day to have the impact?
Different people, I'll give them different answers. Those who are new, those who are going through a lot of trouble, I say 5 minutes a day, because they can't do more than 5 minutes. Those who are on the path, those who have been on the path for decades, it may be 2 hours in the morning, 2 hours at night, and can be anywhere in between. It can be more than 2 hours also. So there's no fixed answer for that question. Even with 5 minutes, you will see a big, big difference.
Can you just throw some more light on introspection? Telling about introspection, to introspect yourself. So how do we introspect and how do you do? Is it with meditation or is it before meditation? Or it's a daily routine of it?
Yeah. When we look at a mirror, we see ourselves. When we look at the mirror of introspection, we see our nature, we see our qualities, we see our thinking, we see our attitude, we see our motives. And just as when we look at the mirror, there are some things that are not very beautiful that we see in the mirror. Similarly, when we look at the mirror of introspection, there are some things in our nature which is not very beautiful. So we have to learn to look at ourselves. We have to learn to ask ourselves, what am I thinking? What is my attitude? How am I speaking? What is the effect of my speech on other people? What is the effect of my, very stern, severe face on other people? Should I be always so stern? Should I always be so serious? Should I occasionally smile? What is the effect of my smile on other people? What is the effect of my severity on other people? What is the effect of the tone of my voice on other people? So we have to learn to constantly look at our speech, our thinking, our attitude, our motive, and training ourselves to look at ourselves. Not to look at the physical body, but to look at the inner being, the thinking, the feeling, the effect of our thinking and feeling and words on other people is introspection.
Thank you, Swamiji. It was a wonderful talk, and we are blessed to have a talk from you, Swamiji. And our secretary, Dr. Narmada, will be giving the vote of thanks.
Thank you very much, all of you. The questions you asked are very beautiful. The smile on your faces is very beautiful. The deep attention and the concentration with which you were listening to what I was saying is also very inspiring to me. So I have been greatly inspired by all of you. Thank you.
Yeah, thank you, Swamiji, for your excellent session. It was really nice.
I saw
the
you
person
in the previous, you were the one who was guiding, you were the master of ceremonies.
Yes, yes. She's our secretary. Ever-loving secretary.
I recognize you from the previous one.
Dynamic secretary, I have to say.
Thank you. Thank you for the kind words, Dr.
You did a
Puri.
beautiful job last time.
Thank you. The person whom you are referring to is my husband, Dr. Ashok, who underwent we required a lot of inner courage and strength, and thankfully, by God's grace, we have come. And I'm a very ardent devotee. I've read the autobiography of Yogi right from my college days, and I've been getting through. And spiritually, I know Prabhakar sir and Dr. Kumaran sir are so much into this. We thought that the benefit should reach our entire members, and that is why we got this. I really thank you for sparing your time and helping us guide into meditation. I'm sure everybody would have benefited with this spiritual endeavor. And Dr. Kumaran and Dr. Prabhakar has taken great strides. He has been constantly asking me to come to the meditation. I have not done so, but this is an opportunity I really had to be with all of them. Thank you so much. I also thank the organizers. They have done a very wonderful work of putting the invitation, sending us a note, very meticulously planned. So I actually did not do any work. Usually, I used to do all this. The work has been taken over by your organizers. Thank you so much. And thank you for partnering with Indian Medical Association Vellore. We received the award for doing more non-medical seminars. So we are again heading here now also doing because we are flooded with webinars. So this is something we wanted to give for our members. I really thank everybody for giving this opportunity. It was really a very nice spiritual Sunday, and to sit and listen to you for nearly 1.5 hours, it was a blessing. Thank you so much. Thank you, Kumaran sir. Thank you, Prabhakar sir. I thank all the IMA Vellore and the many of the doctors have joined. I'm really thankful for every one of the delegates who so patiently stood like 1.5 hours. Of course, your talk has really inspired everybody. And I really thank for making this program a grand success. Thank you so much, Swamiji.
Thank you.
Thank you so much, Swamiji, on behalf of Vellore IMA.
Thank you.
Thank you.